Welcome all OET aspirants to our new video. We are Speaking Aiders. Today we're going to discuss about speaking roleplay. Medication change. Thank you for all the support, we do appreciate that. Please continue to watch, support and subscribe our channel. Press the bell icon for all updates and like button, if video is helpful. Our aim is to make speaking tasks more friendly and simplify them with providing lots of ideas, and you can develop them into beautiful structures. Let's begin the speaking session.
Good morning, my name is Priya. I am the examiner for the OET exam, conducting on 29th of November, 2020. Can you say your name for record?
Good morning, my name is John Samuel.
What is your candidate number, please?
My candidate number is 721567.
And you're taking the test as a nurse, is that correct?
Yes, that's correct.
Can I see your ID or passport, please?
Sure, here it is.
Now, we moving to warm-up sessions. They are not assessed. Basically, it's a chance to get each other's voices. In this part, I will ask you 2 to 3 questions before we move to roleplay. Are you ready, Mr. John?
Yes, I am ready.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps the nurses to update themselves with the current practices in their profession. Moreover, nowadays it is mandatory to have specific hours of continuous nursing education in order to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
Tell me what you feel your greatest skill as a nurse.
I am very proud of my ability to really listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard. Having spent the past 5 years in the medical field, working directly with patients has shown me just how far actively listening can go in helping make someone comfortable. Hence, I feel my listening skill is the best aspect.
Why did you choose OET?
Proficiency in English is mandatory to work in European countries. OET deals with real healthcare scenarios, and I felt more confidence in selecting OET.
Thank you, John. That's the end of warm-up session and let's begin roleplay. Hello, good afternoon, Marshall. I am the staff nurse on duty this afternoon. You can call me Sandra.
Good afternoon, nurse.
How is your day so far, Mr. Marshall?
Well, I'm a bit worried about my stay here.
Could you please tell me what happened?
See, nurse, I think your colleagues are not competent, especially when it comes to handling and administering medication.
Why? What happened? Can you please explain to me in detail?
Nurse, she tried to give me the wrong medication. I have been using my tablets for almost 4 years now and I cannot go wrong. Because I am the one who takes it every day of my life.
Yes, I received the information that you have not taken your medicine last night. Is that right?
Absolutely, nurse, I didn't.
Actually, I came here to speak to you regarding that. Can we?
Sure, nurse.
So, just to reconfirm what you said, last night, the duty nurse brought the wrong medicine to you? And it was not the same medicine, which you have been taking regularly?
Yes, that's correct.
Mr. Marshall, I realize what your concern is. And it's very natural because you have been taking your regular medicine for the past 4 years and you know very well what your medication is. But, trust me, our staff at this hospital is well trained and efficient, and always work with the principle of patient safety. Whenever we administer the drugs to patients, we always follow dual checking steps. Meaning, drugs and its prescription is always checked by the staff, who is going to administer it, and cross-checked by the fellow staff, to prevent any drug administration errors. So, in our hospital, we have very minimal drug administration errors.
I completely understand your explanation, but, as I told you before, the tablet I take for my coronary heart disease is a red tablet, and she tried to give me a white one.
Okay, now I see why you have this concern. If I were you, I would also react in the same way. However, in your case, it was your doctor who changed the medication. Moreover, in our health settings, only the doctor has the right to prescribe the medication, and doctor is the only authorized person to change the medication, as per the patient's needs and condition. And for this, we have documented records too, which clearly show the details of the medication for every single patient.
Nurse, I still refuse to take the medication, as my doctor didn't explain to me about any change, and if I need to take this tablet, I will only take them after consulting with my doctor, because it may affect the functioning of my heart.
I am sorry that your doctor has not discussed the change of medication with you, and in this case, this has led to the confusion. But I will make sure that I inform doctor about this and request him to speak with you. How does that sound?
That sounds like a good idea, and I do appreciate that, nurse.
At the same time, I'm afraid that if you avoid taking your new medication, it may adversely affect your health and may lead to more complications. The primary intention to change the medication is always to elicit better response, and it's true in your case too. So I advise you to take this new medicine, which has been prescribed by the doctor.
No, nurse, I will only take the tablet after getting a proper explanation from my doctor.
Well, in that case, I respect your decision and you can continue to take rest. If you need any help from us, please ring the bell. We are always here to help you. Right away, I will phone your doctor and update him about your decision and request.
Thank you, nurse.
Thank you, Mr. Marshall, for sharing your concerns with me. I do appreciate that.
Thank you guys for watching this video. We hope you guys learned something new and how to do a beautiful roleplay discussion. Please continue to watch and support our contents. Press like and subscribe button to show your support. See you on our next video. Meanwhile, if you have any doubts or suggestions, please comment. We will get back to you as early as possible. Wishing all the OET aspirants the very best. Speaking Aiders team.